I am Dr. Suraj Pandey and I'll be covering my lecture titled Recent Advances in Periodontology Part 2. In the first part, we had covered periodontal microsurgery and lasers. Now, in this part, we'll be seeing some topics. First of all, we'll start with tissue engineering. In 1993, Langer and his colleagues proposed the tissue engineering as a possible technique for regenerating lost tissue. Current approach to tissue engineering can be divided into two main types, ex vivo and in vivo. In the former, the target tissue is created in laboratory by culturing cells on biodegradable scaffolds in the presence of specific trophic factors before their transplantation into the body. In the latter approach, the three elements are placed into a tissue defect in situ and tissue is restored by maximizing the natural healing capacity of the body by creating a local environment that is favorable for regeneration. In vivo, ex vivo. Now, examples of tissue engineering include many common place adjuncts in use today, such as hyperbaric oxygen therapy, guided bone regeneration via the use of barrier membranes, demineralized bone matrix, enamel matrix derivative, and freeze-dried allogenic bone. Now, this is the tissue engineering triad. Again, come in three components, that is cells, example osteoblasts, fibroblasts, scaffolds, calcium phosphate, collagen, and signaling molecules like PDGF and BMPs. Now, all these factors in time and appropriate environment given will lead to regeneration of tissue or organs. Now, if any of these factors is missing, then tissue engineering is not possible. Now, this is a collagen scaffold. See the porosity. Now, the next is platelet-rich plasma. A natural blood clot contains many red cells, approximately 5% platelets, and less than 15 white blood cells. Platelets primarily are involved in wound healing through clot formation and the release of growth factors that initiates and supports wound healing. Using PRP involves taking a sample of patient's blood preoperatively, concentrating autologous platelets and applying resultant gel to surgical site. Surgical sites enhanced with PRP have been shown to heal at rates 2 to 3 times that of normal surgical sites. PRP delivers a highly concentrated dose of autologous platelets containing a variety of biologic mediators that can be applied directly to the healing site. So this is the flow chart, that 8 ml of autologous whole blood, 2400 RPM for 10 minutes. So erythrocytes will separate, create poor plasma and buffy coat. Again, 3600 RPM for 15 minutes. We have two components. We have the PPP and the platelet-rich plasma. The blood being withdrawn and this. Now, factors released from the platelets include platelet-derived growth factor, transforming growth factor beta, platelet-derived epidermal growth factor, platelet-derived angiogenesis factor, insulin-like growth factor 1, and platelet factor 4. Now, the last topic for today is stem cell therapy. The term stem cell first appeared in literature during 19th century. A stem cell refers to a clonogenic undifferentiated cell that is capable of self-renewal and multi-lineage differentiation. In other words, a stem cell is capable of propagating and generating additional stem cells, while some of its progeny can differentiate and commit to maturation along multiple lineages, giving rise to a wide range of specialized cell types. A pluripotent stem cell can give rise to cell types from all the three germ layers, that is ectoderm, mesoderm, and endoderm, whereas a multipotent stem cell can produce all cell types for more than one but not all lineages. The dental pulp stem cells represent a clonogenic and highly proliferative cell population, generating densely calcified nodules in vitro. After transplantation in vivo, a dentine-like and dentine cyalophosphoprotein-rich mineralization product was observed. The transplantation of periodontal stem cells or more mature cell populations has been examined for the potential to reconstruct periodontal tooth support. So that's the end of the lecture today.